A new study has found that no cases of cervical cancer have been detected in young women who have been fully vaccinated as part of the HPV immunization program in Scotland, UK. The Public Health Scotland research said the human papillomavirus vaccine was highly effective in preventing the development of cervical cancer in women. That's great news for vaccinated girls and women, but what about boys and men? Is HPV virus responsible for male cancers? The answer is yes. And the vaccine is now offered to boys in some countries. It helps to protect men from other HPV-related cancers later in life, such as head, neck and anogenital cancers as well as genital warts. Let's have a deep dive into HPV and the benefits of the HPV vaccine for women and man. Human papillomavirus, HPV, is the name of a group of 200 known viruses. HPV is a common virus, usually spread through sexual contact. They do not cause concerns in most people, but infection with some high-risk types like type 16 and 18 is common and can cause cancer or genital warts. In 90% of people, the body controls the infection by itself. However, persistent HPV infection with high-risk HPV types is the cause of cervical cancer and is associated with cancers of the vulva, vagina, mouth, throat, penis and anus. HPV infection causes about 5% of all cancers worldwide, with an estimated 625,600 women and 69,400 men getting an HPV-related cancer each year. Each year in the United States, about 46,711 new cases of cancer are found in parts of the body where human papillomavirus is often found, 25,689 among women, and 21,022 among men. HPV causes about 37,000 of these cancers. Cervical cancer is the most common HPV-associated cancer among women, and oropharyngeal cancers, cancers of the back of the throat, including the base of the tongue and tonsils, are the most common among men. The highest prevalence of cervical HPV among women is in sub-Saharan Africa, 24%, followed by Latin America and the Caribbean, 16%, Eastern Europe, 14%, and Southeast Asia, 14%. Prevalence in men is highly variable. A new study has been published in The Lancet Global Health shows that almost 1 in 3 men over the age of 15 are infected with at least one genital human papillomavirus type, and 1 in 5 are infected with one or more of what are known as high-risk or oncogenic HPV types. These estimates show that men frequently harbor genital HPV infections and emphasize the importance of incorporating men in efforts to control HPV infection and reduce the incidence of HPV-related disease in both men and women. HPV prevalence was high in young adults, reaching a maximum between the ages of 25 years and 29 years, and stabilized or slightly decreased thereafter. In men, HPV infections are associated with penile, anal and oropharyngeal cancers, which are commonly linked to HPV type 16. HPV is the most common sexually transmitted infection, STI, globally. There is currently no specific treatment for HPV infection, but there are vaccines that can stop these health problems from happening. Many countries recommend HPV vaccination for all preteens, including boys and girls, at age 11 or 12 years, or can start at age 9 years. Everyone through age 26 years, if not vaccinated already. Some adults age 27 through 45 years who are not already vaccinated may decide to get the HPV vaccine after speaking with their healthcare provider about their risk for new HPV infections and the possible benefits of vaccination. Most sexually active adults have already been exposed to HPV, although not necessarily all of the HPV types targeted by vaccination. There are 6 prophylactic HPV vaccines licensed for use: the bivalent vaccines Cervarix, Secolin, and Walrenvax, the quadrivalent vaccines Cervivax and Gardasil, and the nonavalent vaccine Gardasil 9. All HPV vaccines protect against at least HPV types 16 and 18, which cause the greatest risk of cancer. The quadrivalent vaccines also protect against HPV types 6 and 11. The nonavalent vaccine Gardasil 9 provides protection against those 4 types, along with 5 other high-risk HPV types responsible for 20% of cervical cancers. It remains a recommendation that women continue cervical screening, such as Pap smear testing, HPV testing even after receiving the vaccine, since it does not prevent all types of cervical cancer. There is no screening for other than cervical cancers, HPV-related cancers in men and women. Therefore, vaccination at a young age offers the best protection. The first HPV vaccine became available in 2006. And as of 2022, 125 countries include HPV vaccine in their routine vaccinations for girls, and 47 countries also for boys. Each HPV vaccine went through strict safety testing before the FDA licensed them. Over 15 years of monitoring and research during the vaccination program have continued to show that HPV vaccination is safe. Pain at the site of injection occurs in about 80% of people. Redness and swelling at the site and fever may also occur. These are the most important facts about HPV and vaccination for women and men. Stay healthy and curious. Hit that subscribe button and share the video with your friends. Thanks for watching, and check out other videos to expand your knowledge.